There, we're recording.
Excellent, excellent. All right. Wonderful. Okay. Thank you everybody for being here today. It's Friday, May 2nd. And before we dive into this discussion, we're just going to drop our usual disclaimer by being here today. We do hope that you are of legal age, and please agree that you are. You also understand by being here today that the information that's offered by Educannation or any affiliated parties is intended for the sole purpose of improving education and knowledge. And you also agree that none of the information that's provided here today should supersede that of your healthcare provider or the laws that apply to where you live. And we are recording this presentation, and this presentation will remain the property of Educannation. We do have a code of conduct as well. We just ask that everybody stay positive and be respectful. This is a discussion and we do want to hear from you. So please do raise your hand to speak. There is a virtual hand in the reactions that you can raise, or you can just raise your hand like this as well, and we will get to your question or comment. And we want to stay on topic. We have a short hour here today and a lot to dive into. So we want to keep it flowing as much as we can. And we are respectfully and humbly acknowledging that we are blessed to reside on the original and traditional lands of the Mississauga of Scugog Island First Nations people. All right. So we are here to discuss today CBD as a natural health product. This is a pathway that Health Canada is moving towards, and they are looking for our feedback. So we're going to be talking today about the questions that have been provided on the online feedback form. And when I stop my share, I will provide that for you. There's just too many things in front of me right now. We're going to be talking about access, quality standards, labelings, where products should be sold, and how to ensure equity and informed choice in the future for these products. And we have 18 questions that we are going to be diving into today. But first, I want to share a little bit about who we are. We are Educannation, and we are Canada's first and only association of certified cannabis educators dedicated to providing the highest standard of responsible education, supporting respect for holistic plant medicine. We've been around since 2000, founded by my partner, Shauna Dunbar, and we are the executive directors here at Educannation. This year, we have launched our Alternative Wellness Access Center for Education, where we guide and support patients on their cannabis journeys with compassion and evidence-informed insights. And as well, we have our Alternative Wellness Outreach Education for Communities, where we bring tailored cannabis education directly to communities who need it the most. We've already had the honor of speaking with both cancer and endometriosis support groups, and we just help people better understand how this powerful plant can play a role in their healing. And you can become a part of the Educannation community. We do have a membership. We have membership that is tiered for you. Whether you are just kind of curious, you can join our community membership at $28 for the year. Or if you are somebody that has some educational background and educates about cannabis and is looking for more guidance and support, then please join our leadership membership. It is $99 for the year. You can apply at educanation.info/membership, and I will provide that link later as well. And there are other ways to get involved with Educannation. You can partner with us, you can become a volunteer on our board or our advisory committee, or you can sponsor us as well. And we do have a sponsorship package that we can share with you that shares all the details of that as well. And we want to thank one of our amazing sponsors, Dave Marcus here from Whole Hemp, who is one of our most recent sponsors. Thank you so much, Dave. And so we're here today because Health Canada is asking for our input. They are considering making CBD a natural health product. So we are here today to collect insights and experiences from, people in the know, people who are involved, people who are utilizing this product, so that we can make recommendations to Health Canada based on these responses. This is part of what Educannation does. We advocate for patients' rights for accessible, safe, and affordable medicine. When Health Canada reviewed the the Cannabis Act. We formulated a 32-page white paper that we submitted to Health Canada for their review, and then we will be submitting another white paper on this topic as well, based on our viewpoints and the opinions and points that are made here today. So we are going to dive into the discussion, and I'm going to pass it over to Shauna to do that so I can take some notes. And while she is diving into that, I'm going to drop some links in the chat for you as well.
Perfect. Thanks so much, Jay. So like I mentioned, we are here today to get your opinions on this consultation, to include, to make sure that we are representing our community and not just our own opinions. So I would really love this to be an open discussion. I cannot see all of your faces, so if you put your hand up and you're not getting answered right away, please just unmute yourself and jump in. We really want to get to your feedback. So the first question on the list is, what are your views regarding the need for a cannabis drug license and specific physical and personal security controls required for natural health products containing cannabidiol? Does anybody want to jump in? Just to understand that this means currently our CBD products are under regulations under the Cannabis Act. This means additional regulations through the natural health products, and potentially even stricter rules regarding, they're talking about adding extra legislation. So would anybody like to jump in and give their opinion?
We don't need any extra legislation, in my opinion. It's so hard to get anything already, and what it needs is marketing. It doesn't need legislation. It seems that the rules that are set up for the LPs to be creating the CBD seem to be working. I'm not the one that's in depth. It's just that people don't know what to get, what kind to get, CBD, CBDN, CBDG. They can't talk to anyone, to these Walmart greeters in our recreational stores. So we need just openness and not more barriers put up for access. And that's all that we faced through the federal government for 25 years is barriers. They've never, ever honored the Parker Supreme Court case to really provide us with dignified access. So what kind of new legislation do they put up? If it frees it up, I'm okay with that. But if they're going to make it more controlling, it's just wrong.
Thank you so much, Joy. Christina, you had your hand up?
Yes. Hello, everyone. Initially, I thought I was very excited about this. I'm like, oh my God, more access to CBD, but I'm seeing that it's just going to become more convoluted. So I don't know what the best strategy is in terms of is it better to use this opportunity to push for a bit of deregulation and say, okay, we've all seen that CBD is safe now. Can we just relax a little bit and just kind of use this to understand that it's not as difficult? And, is this the time for us to ask for a little bit of deregulation on I don't know, because usually I'm more like, oh yeah, let's just answer their questions and give them a little bit of info, but I'm just proposing this as one alternative. I mean, I think we should say yes, definitely, these are the regulations. They should be very easy. And we should also make the point that the more regulations we put in place, the less compliance we're going to have.
That's a good point. Dave?
Yeah, I just wanted to bring up the point that in the document, Health Canada's document towards a pathway for health products containing cannabidiol, they specifically say we are also considering burden reduction elements, including not carrying over the cannabis drug and research licensing requirements when a regulated party is only handling CBD.
Do you feel, Dave, that like, I remember that phrase, and to me, it spells out another pathway for isolates. Like if it only contains CBD, that means, in my opinion, I read that as that doesn't include that, 0.3% that is being allowed in current CBD products. What's your opinion on that?
So I think that clause is uncertain, except at least that they're raising the possibility of having less regulation on CBD rather than, and possibly pulling it CBD out. But I think you've hit the nail on the head from my perspective that the scientific advisory committee's comments that seem to be the basis of this ongoing request for proposals and moving now into natural health products is based on, from my standpoint, an erroneous assumption, which they didn't ever justify or footnote or otherwise say where it came from, which is basically CBD that's isolate based, because I think they're saying it has to have their position from the outset that wasn't justified was THC should be less than 1%. And that does not exist in a full spectrum hemp derived CBD product. So our position has always been, and I think I think the ratio of 20 to 25 to 1 CBD to THC should be the basis. If there's concern with THC and intoxication and any of these things, while allowing full spectrum products, I think that ideally 20 to 1 ratio, and I think probably the industry could work with a 25 to 1 ratio, but it does limit the genetics at 20 to 1. And generally, I would say, if it's hemp derived, that pretty much ensures, if it's a high CBD hemp variety, it pretty much ensures that the CBD to THC ratio is at least 20 to 1.
Okay,
I mean,
great.
the one thing I'll say about that is, though that's generally true in our experience for high CBD varieties, people are always looking for loopholes. And so you could theoretically have hemp varieties that were only 2 or 3% CBD, let's say 2.5% CBD and 0.25% THC, and you would have a 10 to 1 ratio. So it's not that the 20 to 25 to 1 ratio exists by definition in all hemp, but for anyone who's breeding to maximize CBD expression in cannabis and still keep their varieties as on the list of approved cultivars at less than 0.3% THC, you invariably end up at least 20 to 1 as a ratio. And in our experience, like with our customers, we've tested 5 to 1 and 10 to 1 ratios with customers just to see what the market wanted. And we had feedback certainly at 5 to 1 that people who had problems with THC, let's call it, right? Whether it be a negative reaction to THC, 5 to 1 was not good for them. But with any of our standard hemp derived products that were at 20 or 25 to 1, we've never had any issues with people who have intolerance to THC.
Hi, I hate to interrupt. Can I make a couple of little comments here and also throw some stuff out for you guys to consider when you guys are looking at all this, if that's okay? So my name's Cheryl Rose. I have been working in this industry since 2008. My daughter was Canada's first federal pediatric patient. Her namesake strain is Haley's Comet. I would like to point out some patients when it comes to the CBD THC ratios. And again, of course, yes, you need anything from a 25 to 1 to a 1 to 1. My daughter cannot have a high CBD. She cannot have anything higher than a 1.3 to 1 ratio of CBD to THC, or it will actually increase her seizures. So there is things like that I feel like Health Canada isn't necessarily looking at. I know that we're looking at with the low THC. I have a question as to where the acids come in play. So like raw cannabis, I am currently researching raw cannabis as a functional food, which includes, I'm looking at the entire spectrum from high THCA to high CBDA, but and where that plays in our health. So with stricter regulations, that could become problematic as we delve more into the agricultural area. There needs, I feel, because I work with both medical, my daughter uses 1-to-1 cannabis for rescue drugs. So it is her rescue med. We give it to her nasal, we give it to her vaped, and as well, she can have it oral. She used to be on it as well as an oral medication. So like her regular dosage up until 2 years ago. And now it's an adjunct therapy for her ketogenic diet. But it's raw cannabis. And I know this is about CBD, but hers is actually not a CBDA. It's actually THCA that is a functional food for her. With CBDA, there's that should be available as well as a food, as a.
Yeah, absolutely.
So I'm sorry, I'm reading comments here too. I apologize.
No, that's okay. I'm just this current consultation is specifically about CBD in becoming available in natural health products.
Which it absolutely should be. And I think that the regulation should be less, not more, absolutely less, because as it's in natural health products, we're looking at it, that signifies that it may become more of a food type product, right? Am I wrong to assume that? Then when you're looking at it as, are you looking at it as like supplements?
Like a vitamin,
Yeah, right?
What's
Okay.
being put forward by the government is the potential to have it available in natural health products. So, where is that going to be available? Potentially in pharmacies, natural food stores, the types of places where we would buy supplements.
Yes.
It's also considering regulation around the veterinary use of CBD. But
Okay.
to your point of acid form cannabinoids, that's one of the things that I keep questioning. Why are we only talking about CBD? Why are we not talking about the other, non-intoxicating cannabinoids? So that's certainly something that we would like to address in our response.
Absolutely. There is my daughter is a prime example. Her strain's considered a 1-to-1, but I have not found, she's actually, when it comes to regulations and stuff, she's actually not receiving from licensed producers. One, they don't have her strain, and I've tried other strains from medical licensed producers that are 1-to-1s and full spectrum, like hers, because hers is also full spectrum, but they did not give her the same relief. And that is due to the different terpenes and minor cannabinoids within the plant, because hers has THCV and other things like that in it. So I absolutely am 100% with you on that, on getting them to pay attention to these other cannabinoids, because it is not a one fix, right? With it. So.
Absolutely. We are not talking about the medical market, though, or the recreational market. This is going to be a potential step beyond. But of course, this is opening the doors for people to allow themselves to self-medicate even further, right?
Yes. Well, it's like you can go get melatonin, or you can go get something else like that, another type of natural supplement at the at your health food store. And the thing about it is, they'll also, even though it's a natural supplement, you're just buying off a thing, it will state, oh, don't take this with this. And CBD has to have that warning, because if you're on other medications, you could really have a negative effect.
Yeah, so that's
great warning, right?
Yeah, really great point. And that's going to be, a response that can be made, it's within these questions as well. So let's move on, because we don't have a lot of time together. So I'm seeing in the chat as well that everybody seems to be on the same page. We don't want more rules. We want less rules. We want it to open up more. So this next question is asking about additional raw material drug good manufacturing practices standards, qualifications necessary for Cannabis Act license holders supplying raw material for natural health products containing CBD to ensure that CBD being used as an ingredient in natural health products conforms with established standards for natural health producers. Does anybody want to chime in there?
Nadine had her hand up. I don't know if you still wanted to
Sorry,
make.
I missed that. Nadine, did you want to jump in?
Oh,
point?
that's okay. I agree with everyone that, we don't need any more rules, but my point was going to be that, my understanding of why the rules are as they are is because the government wanted to go heavy so that they couldn't add more. They kind of put it at a level where, okay, well, if we go too low, if we say, okay, we can do everything, no limits on THC, no, limits on beverages, anything like that, they can't take anything away. By making the rules the structure that they did, they can ease up on those rules, but they can't, if they set them low, it's harder to implement more rules. And now here they're taking the most safest aspect of the plant and wanting to add more rules to it. It just is, it's ridiculous. Yeah.
Yeah, it is ridiculous, but
Yeah.
it's a good point because we are actually seeing within the Cannabis Act legislation that things are starting to, like there have been some recent changes. So very good point.
Yep.
Um,
But no, there should not be, other than food safety, what you could sell in a grocery store, as long as it's got that little stamp, that shouldn't, as long as it's safe for public consumption. Like, what more do, anyways,
Yeah.
Dave,
don't get me started.
Yeah.
did you want to respond, Dave?
Well, I'm not sure where the GMP comes from because currently it's GPP, not GMP, and GMP is a lot more strict. So,
Oh,
for
this was,
example,
yeah,
if
well,
you want to sell
a
to
lot of
Europe, you got to be
from this.
GMP. But look in the cannabis regs currently, it's GPP, and it's sort of a level down. So I would imagine it's going to be whatever standard in NHP in natural health products. I don't think they'll.
I don't know. As I was looking through, it seems like they're potentially proposing to beef those regulations up specifically for CBD products. And this is specifically about raw products, which I'm assuming is that raw product that's being, like Mary Ann sends you her raw product to process, right? Within the handling of that.
So I'm not an expert on GMP. We're not GMP certified, but from what I've been told, a GMP licensed facility can take product from a non-GMP supplier as long as then it fits in. But I would say moving to GMP from GPP would add a huge additional burden and knock out smaller players. So I
Yeah,
think
very good point.
yeah, GPP as it stands currently in the cannabis regulations has proven to be more than sufficient. If anything, I would agree that, even toning it down a little is probably worthwhile, but certainly we don't want to go the other way for more regulation.
Okay. The next question is about certificate of analysis. Personally, I feel that I wish it was required for every cannabis producer, whether you're recreational or your medical or your natural health product. I, I would love to see the COA on products. That's product transfer they are getting. Christina, did you want to jump in? And then Michelle's next up. Oh,
We're breaking up there briefly, but
Yeah.
seems people got the idea.
Yeah, even if it was just a QR code on each packaging that leads you right to the COA. I saw that on something and I was like, that's brilliant. Just easy. It's there. It's accessible.
well, I've heard that is and where we're potentially moving within the Cannabis Act. I don't know, Dave, if you have any insight on that. as a producer. But at the last AKIC meetings, regarding this, they were talking about QR codes for more product information.
So QR codes are now allowable, which they've never been before. But I've not heard anything where there's a requirement to link it to a COA. But certainly all product must have a COA. So it's not like we don't have them. It's just really, I think what I'm hearing, and it makes sense to me, is make them available to the general public.
Yeah, I know some licensed producers do, while others, like I'll call a licensed producer up to understand, more about the product. Specifically if a patient has, let's say an allergy or something like that, and they're not always willing to let you have access to it. They're not required, from what I understand. So.
Certainly they should be required, I think. I mean, we've been asked and we always provide it. I mean, I can't imagine why you wouldn't, given that you have to have it and it's part of your regulatory package. It gets, audited when you get audited. It's sort of it's a necessary part of the business.
Absolutely. Christina and then Joy.
Yes. So I was just typing it in the chat. So the COA, yes, very important to have. But I also worry that it's not a complete picture. So I think that, like we shouldn't be relying too much on the COA, because things like the growing conditions and the growing medium and the post-harvesting and whether it was irradiated, those are things that can influence the quality of the product, a lot. I'm just saying this because I've seen, I've come across brands that are very happy to provide a COA, but then I'm not even sure like that it's accurate. And so COA alone is great for, making sure that there's no heavy metals. So it does help something, but I think it shouldn't be exclusive. Like we need access to additional info to make informed decisions.
Yeah, I see that Nadine has dropped that in the chat, just like a food label. That's what I've been saying for years. I would love to see, like, on my bottle of oil, what terpenes are in there and, what flavonoids are in there and all of these things, like just more information, like a food label. So Joy.
Yeah, are we aware of the NHP organization, Sean Buckley's natural health products that have been lobbying government for at least since 2008 for better changes with natural health products? Are we engaged with them at all?
Our organization hasn't been, but we will grab it from the chat and definitely reach out. Thank you for that.
Yeah, they've been really, because even under the Harper government, they've, in brief, wanting to eliminate our access to supplements altogether. And there's been a battle. That's why Sean Buckley's been there for so many years. And he's influenced a lot of the legislation, his organization. I just thought because I agree, this should be under natural health. It's not pharmaceutical in any way, shape, or form. That would be a good alignment for us. Just a question.
Thank you for that, Joy. Kirk?
Hi, this is my first time attending one of these meetings, trying to get a flow. And excuse me if I'm saying something you already know. I'm very skeptical when it comes to government, and I'm not quite sure how our feedback's going to help, because what I understand here is that if a product is to become a medicine or a natural food product, the source has to be good manufacturing practices. It's one of the reasons why cannabis research as medicine is very difficult to do right now, because any product you get from the grower, the licensed producer, all through the food chain, every one of those businesses have to have this certification. They must practice at good manufacturing practices. Hence why a lot of research is not getting done in medicine. So this is where and again, I apologize if you are aware of this, but I'm not quite sure how our feedback is going to help, because if the government wants to make it a natural food product, that product has to go through this process. So no matter what we say, it's not going to change the outcome. And that's my understanding how these products are given sanctions. The other part of the conversation about COA, of course, all products should have that, like any food product, even our processed foods have it. But when it comes to manufacturing CBD, not clear how our feedback's going to change. And that's my ignorance with the group. Sorry.
No, that's okay. I think that we're all kind of skeptical sometimes, but this is Health Canada is reaching out for to consult with us and ask us our opinion. So we take that seriously and want to make sure that, you know, we hope that they're going to listen. I know Dave has let us know, he's a licensed producer, that that they are listening. So, you know, really making sure, and really great points that you brought to the table there. Thanks, Kurt. Jay, I think we'll move on because we haven't even gotten past our first slide yet. I have a feeling we're going to go overtime today. So please note that we are more than happy to do that. Joy, did you have something else you wanted to say?
I do. I was in 2011. The Health Canada, they had consultations on the marijuana issue itself, and I was invited into the consultations. There are many advocates at the time that were deep in the movement. Health Canada they did the opposite than what anybody in the room said. They do these consultations to let people think that they're actually consulting with us. But when it came to marijuana, they certainly did not listen in any way, shape, or form. I don't trust these consultation processes simply because from the political thing, and you know, I've been at the table elected, they're just to make themselves look good. They're not they're not listening to us. And that's what frustrates the heck out of me, that they're doing this, but we want to believe, but for 25 years they've lied to us. So I have no real reason to think that a lot of our energy is going to be beneficial for our movement. And that's me becoming very skeptical of it all. Just my opinion.
Yes, and we appreciate that. I'm on the same side as you are, but I still will take any opportunity to make my voice heard. And I think
Don't be too disappointed.
yes, exactly. So given the potential for concurrent health product and prescription drug use, is there need for natural health products containing CBD to include a warning statement? Someone already made mention of this earlier. I think absolutely. Again, this is product transparency and letting people know that there are potentials for drug interactions, interactions with other natural health products. This is about safety. Does anybody else have any concerns or anything to add to that? No hands up. That's okay.
I keep mentioning the grapefruit warning. It comes standard with CBD safety, and that I think that should be standard.
Yeah, agreed. Please describe any barriers or concerns with clinical trials that you are currently facing, or products containing, for products containing cannabidiol, or you anticipate might impact your ability to produce evidence to support the safety efficacy of a natural health product. So natural health products are supposed to have clinical trials that they bring forward. I'd like to pipe in to say that what I'm seeing a lot of is clinical trials that are being done with isolates, back to that isolate point, right? So that for me, that's a major concern. That is a barrier. And I don't know if that is just the scientific community that is pushing towards that. Is it the pharmaceutical industry that is pushing towards, or is it just us as humans that like to break things down into little tiny pieces so that we can really understand them better? Would anybody else like to jump in on that?
I can't help but wonder if the government, having already sort of stated the intention is to have essentially an isolate-based system, has led people to then follow that path.
Yeah.
Right? I don't think it should be, but you know.
Yeah.
And
Yeah.
it's not a pharmaceutical based product. So where's the funding going to come for research? Who's going to fund research for isolated synthetic cannabinoid product? Like,
Yeah, good point.
we already have a hard time with studies because we know that they're studying isolates and synthetics and not whole plant. So I feel like we're kind of still stuck there.
Well, and it, you know, from my understanding from the past, I know things are moving forward and changing, but doing any kind of studies in Canada on cannabis has been very difficult over the years. So, you know, hopefully some of that has been opened up, but I think there's definitely a lot of barriers there as well. Joy?
I think we need to start writing our members of parliament now that we have a new government, and let our new prime minister know the realities of our pain in our community, and the individuals that will be totally affected if we don't have the CBD and other cannabis products opened up. We're into a time of turbo cancers. I don't know about your circle. I've lost 20 people in the last 2 years, showing up at the age of 54 with 3 different types of cancer and dead in 6 months' time. And we know the benefits of medical cannabis to help with our cancer journeys. And I don't think our new prime minister does. In my background and my experience, I've been petitioning and nobody listens. No, I shouldn't say that. That's incorrect. Not enough people are listening. You need to engage your uneducated elected officials at both the provincial and the federal levels. And that is simply not happening. We can't continue just to deal with bureaucrats. We need to get the political people involved. And I don't see that happening. Maybe it's just not happening here, because I seem to be the only one that's kicking the can at our provincial and federal levels. So is it happening out in your neck of the woods that people are actually engaging the elected official?
Yes, absolutely. We do have partner organizations who are doing exactly that, banging on doors, and doors are opening. So I think if we just collectively bring our voices together, which is our point of running today's session, is to gather everyone's opinions and voices, and you know, making sure that it's a little bit louder for putting it all together. And this is also why we are not going to simply just respond to the consultation, that we're also going to create a white paper that we can then distribute to, you know, our local MPs and, you know, so on.
Great, thank you. I didn't know that.
Nadine, I see that your hand is up.
Yeah, just 2 points. I just to comment on Joy's messaging there, and you know what we find with the cannabis is the politicians are not going to listen to us. We're businesses fighting the government. The consumer needs to join our fight, and I think especially with CBD, the medical community that utilizes that cannabinoids, or you know, those properties of the plant without activating the THC, need to be the ones coming to the fight with us. You know, they need unfortunately in this country we need to advocate for our own medicine and our own medical health. So so that was the one thing I wanted to add. But the other thing I wanted to add, I keep coming up, is you guys were on the call on Monday with CCTA with Larry from Las Vegas, and his comments on, you know, their struggles with their whole medical, air quotes, stores, and I don't recall exactly what he said, but they're harvesting prior to the growth of the THC, or they're dipping it, or they're messing with.
Talking about Delta 8, which is
Yeah.
derived from CBD and not from THC.
Yeah. So who's to say that's not going to go down if, you know, this all comes to play, right? And
Yeah, we
then
need
we
to
have
make
the
sure
with the
that
recreational market, you know, coming in, and you know, talk about consumer confusion, right?
So
So
another step, that once we have formulated our response, we are also going to put together a form of like, you know, through a AVAS or one of those like petition making
oh
apps,
yeah,
where they call them, so that you know, we can push it out there into the public and allow people to
yeah,
add their names to it. Again, building the voice
awesome.
our voice, and hopefully we can have some, some patients join in on that as well. So, Kirk, you have your hand up?
Yes, I'm just looking at the three questions that you have in front for discussion. Again, very skeptical with how government does feedback. I just interviewed the Manitoba government about our 4-grow. We just got our 4-grow. We're only allowed indoor grow because outdoor grow is hazardous to children in the neighborhood. Different issue, but skeptical about government. Question 5 should be question 4 because question 5 answers question 4 in the sense that there are already, so in the sense of us giving feedback, there's already barriers in the system to ensure that the research that's getting done is done on pure CBD isolate. And those scientific principles are already built into the process, and they are the barriers. So when they want us to identify or describe barriers, well, they're already there, man. They're already there. Now, because the research is not happening, because of the good manufacturing and the things that are being, oh, and by the way, it's happening in Europe. We've interviewed companies that are doing the research in Europe. But then you get to question 4, and question 4 answers itself. Because natural products already put warnings on there, right? So if there are warnings, then there's been enough research to put the warning on. You know what I'm saying? So they're asking us if there's concurrent health products and if there's a need for warnings. Well, if we were allowed to do the research, we would be able to answer that question.
Yeah, well said. Well said.
Right. So I'm thinking our feedback should be logical in its presentation and to let them know that we're not naive to the fact that these questions mean nothing. Number 6, where should they be sold? Well, where are they sold now? Right. So, and we're not talking about rec shops. We're talking about med shops, and we know it's already sold online. So maybe we should say in pharmacies, right? And we should say, not just online, because I mean, doctors are already sending people to rec shops for their meds, and the government's already alluded to the fact that it could be a Colorado model. Maybe you go into a dispensary, one size medicines, one size. I get off the topic, but these questions, I would provide our feedback by following the order of these or changing the order. The questions are benign questions, so outsmart them by telling them, their questions answer themselves. My suggestion.
Thank you, Kirk. Does anybody else want to respond here, or can we move on to the next one?
Fine.
Dave, go ahead.
I just want to say I'm not absolutely sure that clinical trials are going to be required for natural health products, but I think it's important for us to say that as a community, as an industry, as educators, we have all this evidence already, which may not be formal clinical trials, but needs to be considered because these are natural health products that are being used, and there is all this experience, and that cumulative experience from this organization particularly, I think, should actually have a significant impact. And so I think the point should be that from our experience, clinical trials are not required. This is not medicine. This is a natural health product. I don't believe you need a clinical trial for any other natural health product.
Well, this is what's on the table with what, Joy had mentioned earlier about how Health Canada is also working to not allow us access to health products, right? So, more controls on natural health products to make them go through the same types of tests and everything that the pharmaceutical products go through. Not that I personally feel that they seem to really go through anything rigorous before they're out there on the market. But so that's one of the points that is in play here as well. So I think that yes, we've already had this conversation, Dave, that we absolutely have to include in our response our anecdotal evidence, our experience as educators, working with people, consuming these products. it definitely needs to be included in there. And again, to our points in the beginning, that we need to tone down the regulations, not make it more difficult. And I think requiring clinical trials, either they're going to have to facilitate quality clinical trials for us to be able to do with whole plant medicine, or just get rid of it completely. Shall we move on to the next one, Jay?
Yes, ma'am.
Thank you. Here we go. What retail considerations for natural health products containing CBD would optimize consumer safety and prevent misuse of products?
I think we just kind of covered that, didn't we?
A simple label of this is what it contains, and these are considerations. Are there any further considerations on advertising and promotion of Health Canada? That Health Canada should contemplate. Yes. How about allowing producers to actually advertise their products to consumers? It doesn't exist right now. This is a loaded question. We're not allowed to do this. So further, anyway, go ahead, Joy.
Yeah, do you realize that Health Canada is advertising on the radio about the risk of cannabis? I'm shocked. After all this time, they're still doing that. And that keeps the stigmatism high, or the stigma high. That means that people stay away from the medical benefits of it. It's just absolute garbage. No trust. I'm sorry.
That's okay. You're amongst friends. I don't see any other hands raised. Are there any further considerations on vigilance that Health Canada should contemplate?
I think that, and I was kind of just responding to Joy's there, that the issue isn't so much that half the issue is that we can't advertise about the medical benefits of the other cannabinoids, but the other half is that the recreational market is so heavily in the highest concentrates and percentages. That's why those messages are coming out on the radio, that they have to caution people about using cannabis these days because of the intensity of it.
Yeah, good point. Very good point. And unrelated to non-intoxicating cannabis products, but yet they lump them all together, right?
Mhm.
And it's THC is bad. Everybody is afraid of THC, and we are just going to lump CBD and any other plant that doesn't have high concentrations of that in there. I like that point, Michelle. Thank you. Go ahead, Dave.
I just looking, I don't know much about the clinical trials, but I do note that under natural health products that there is an exemption for traditional products. And that might be a very interesting little exemption for cannabis, given its thousands of years of history.
Thank you. That's a really good one.
I just wanted to say, when we're looking at CBD as a natural, like a supplement, and we're looking at it as a medicine, as we've seen, cannabis in general, the medical aspects and the research has fallen behind due to, and I hate to say it, due to recreational, but we do want recreational available. It needs to be taken into consideration that when you go and you decide to add let's say potassium, or like no salt or whatever it is instead of salt, so you're adding it to your foods, right? That would be like a natural, it's a food, but then you could also go get pills of potassium, and then you can also get a prescription for pills of potassium. And I feel like that sort of ability to have it meet all these different things, right from food to natural, as we're talking about natural health products, as well as ensuring that we do not lose the research behind the medical aspects. Because like many of the natural supplements, you go one end, you're looking at a food, you go the other end, you're looking at a medication. And I think it's really important that we ensure that they don't, while we don't want them to add more regulations, there needs to be that nice flow that we're seeing with all these other things that are out there. And I feel like there's a real big disconnect between those things. That's just my opinion.
No, I agree with you. I think that, you know, separating it up like this, my personal fear is that this just goes along with the whole idea of getting rid of the medical cannabis
Yeah.
system. You know, okay, well, so we made CBD available to you here. You can get THC over here on the rec side. So let's just get rid of the medical system. We don't have to, you know, deal with all the liability and you know, the calls to action from the patients who are asking for better care, who are asking for better access, who are asking for education and guidance. Yeah, I feel that this is a potential pathway to allow them to be able to do that. So, yeah, we definitely need to include that in our response. I think unless anyone has anything else to say here, I think we've covered this quite well. We can move on to the next one, given the time as well.
Mhm.
So this is talking about the veterinary side of things. So allowing vets to be able to prescribe and have these types of products. All new drug submissions need to supply data that ensures a drug is safe, effective, and high quality chemistry and manufacturing. This data is then carefully reviewed. Would a more streamlined regulatory approach be appropriate? If so, how could a regulatory approach be streamlined? Note that with vet products, notification program is not an appropriate option as treatment, prevention, and cure claims are not permitted. So it sounds to me like they're opening up for like CBD dog bones and, you know, these sorts of products and not actually putting it in place for vets to be able to prescribe it, just to be able to offer it. I don't know if we have any vets in the room or anyone who is on that side of things or any experience that might like to chime in. I do know that I see, like in one of our local pet supply shops, they're carrying CBD products, which they're not supposed to be. I know that they're not allowed to do that, but somehow they are doing that. I find it interesting that I guess Health Canada certainly doesn't have the time to go check out pet shops, right? They have other things on their plates. It sounds also to me like they're asking if they can make it easier for vets to sell these products, and yet they're making it more difficult on the human side of things. That doesn't make a lot of sense to me. Would anyone like to jump in here?
I've been into some vet clinics just to talk about CBD and pets, and they basically say, I don't want to talk to you, even though we have a veterinary association for cannabis. They need more education for sure. And I've seen products in some of the retail stores that they're advertised as hemp products, and the people in the stores actually believe that there's CBD in them. But when I pick them up and look at them and show them, it's just hemp oil and some terpenes added. Yeah.
Yeah. Nadine?
We had a pet food store, a local pet food store, and they would make their own CBD for pets. I am a strong advocate for plant-based medicine for animals. For my dogs, I have 3 beagles. Beagles are, you know, highly anxious by nature, and we've used it quite successfully with our dogs, and it should be readily available, and it shouldn't be $100 a bottle. So that's, you know, kind of what I see in my area. And, you know, it's the same price as you would get. I mean, it's pure CBD oil, but I think it's pretty much the same price as on the recreational side for a pet. But, you know, and I mean, correct me, there's a lot more education on this panel than I have, but my understanding is that every being with a spinal system has an endocannabinoid system. So I think the first thing that needs to happen with vets and animals is breaking that stigma again. You know, here we are with the stigma. and even THC in very, 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 very small amounts, you know, can be effective as treatment for pets. But because they're so much smaller than us humans, you know, it's all proportionate. It's dosing, proper dosing. So I think that's, you know, where the vets come in. No, they shouldn't get a free ride because they've been fighting it more than everyone else. So, you know, if they're gonna increase the rules for us, they better increase them all across the board. But
Yeah, I agree. The next question is about, you know, whether they should have specific physical and personal security controls. Well, yeah, shouldn't it just be the same, like across the board? If you're going to have an insert or a QR code that, you know, talks about the potential risks of CBD, then wouldn't you have exactly the same thing for vets? They have the same endocannabinoid system that we do. And as far as I'm concerned, the products should be treated in the same way as they are for humans. There's no difference, except perhaps the administration method, you know, the delivery of it being in a dog bone instead of, you know, I don't know, a chocolate or something like that, right? Okay, let's move on to the next slide. And please, if I miss anyone, just unmute yourselves and jump in. So for evidence on manufacturing processes and quality control, what level of evidence scientific review would you expect for a CBD product? I believe we are still talking about veterinarian products here. Jay, do you remember if it was under the same title?
I don't remember, but I mean, it could apply to both.
Yeah, I agree. And again, these questions seem to be very much, it's redundant.
yeah,
Yeah,
it says it is vets because the next one says, is that VDCC? Would that be vet?
Yeah.
Yeah.
Yeah,
So,
so
yeah,
I'm sure we're all thinking that the regulations are the same or should be the same as far as
absolutely.
whether it's for a human or an animal, we're all sharing the same endocannabinoid systems, right?
Yeah.
Yeah, exactly. Number 13, one approach proposes that good production practices, which is what Dave was speaking to earlier, requirements under the Cannabis Act would apply if you are producing CBD, and the good manufacturing practices requirement that goes under the Food and Drug Act and Food and Drug Regulations would apply if you are sourcing CBD medicinal ingredients from a licensed producer. I think I feel like, Dave, you are the person in the room who has the most experience as a licensed producer to respond to this. Do you have anything that you'd like to add to the conversation?
I mean, my general feeling is that the GPP requirements overlaid with the current cannabis regulations absolutely result in higher quality products going out to consumers, right? So having to have a COA, having to ensure there's no pesticides, that there's no, you know, there's no mold, there's no, you know, these types of products, you know, we have, you know, I think it basically boils down to having a COA that meets the requirements of the current cannabis regulations, and and GPP is just sort of inherent in that. Now, could there be other things that are listed on the label other than what's on a COA? I think that's completely reasonable, but I think the ones that are currently listed actually make for the products that are currently available under the cannabis regulations, that there's a high level of accountability and safety for the end consumer that I personally, I think is needed, because you know, everybody's looking for a loophole, everybody's looking to take a shortcut, right? If people didn't have to test for pesticides, they wouldn't, and that's expensive testing, but then we would have products that have pesticides in them. Personally, I don't like that idea.
No, agreed. And on to the next question. I believe you can all read, so I'm not going to read it as it is on the screen, my eyes are starting to get a little bit wonky. But again, I feel that this is a redundant question.
Yeah.
You know, if we all agree around the table that these products should be treated in the same way that human products are, then I think we can move on.
Two more.
So give, oops, sorry, Jay.
Oh, just saying there's 2 more slides.
Okay, great. So given the potential for current health product and prescription drug use, is there a need for, we've already answered this question.
Okay.
Yes, it should have the same warning labels. Describe any barriers or concerns with research studies that you are currently facing for products containing CBD or that you anticipate might impact your ability to produce evidence to support the safety or efficacy of veterinary CBD products. Again, I think that these are the same limitations that we spoke about earlier regarding research, and that what we're seeing is that the research that seems to be sought after and that our government is accepting all seems to be done on isolates, pulled, you know, not on whole plants. So I think that that's very important that we address that issue every time they ask the question. Go ahead, Kirk.
Again, not to be redundant, but I finally just, I think as an organization, we should be all over this. We should be saying, of course, you need to do this. We support this, but there is some irony to this. You are expecting research to be done on pure isolate, which is important because, like I said earlier, if we accept it as a natural product, then we're demoting it. This panel treats CBD as a medicine. So we're asking the government to treat it as medicine. So I would basically say in our introduction, we agree with this, but does this not fall under the auspice that CBD isolate would be seen as a medicine? Because you're following what laboratories must do. And the irony is the medicine our people, our clients are taking now doesn't follow this strictness, right? So this is purely for research purposes, and we should be all over it, but reminding the government that they should not be putting this as a natural product, but as a medicine. So start treating it as medicine, right? So that's where I would take our feedback. Say, yeah, this is all good, but treat it as medicine.
Yeah. Well, I think we've all been advocating for this for ever, right? Go ahead, Dave.
Well, I mentioned in the text or the chat, but if there is an avenue for traditional medicines to be exempt from clinical trials, right? And all of a sudden, I really like this idea that isolates are not natural health products, and they should actually be under the medical realm. That would totally turn this on end, right? So if it's a traditional product, which we can prove that has efficacy that we can show us certainly anecdotally, and therefore doesn't require clinical trials, then the only way you can be under an NHP as a cannabis product is to be a traditional product, which by definition has to be full spectrum. To me, like that's
I love that.
that's kind of that's the path, and I love the idea of isolates having to be under medical. They shouldn't be. We should actually be saying that contrary to the scientific advisory board, like those products are not natural health products.
Yeah, let them have their drugs and we'll have our plant.
Totally.
Yeah, make them
Exactly.
get a drug identification number for the CBD isolate.
Totally. Love that.
Yeah, I absolutely adore this, and we'll use that wording verbatim in our response. Because what a change that would make. It is driven, the isolate aspect of it is driven by the pharmaceutical industry, right? So, yeah.
We've interviewed them. We've done episodes on this. This is what the pharmaceutical company wants. This is big pharma getting into the cannabinoid space, which some of us want, some of us don't want, right? I mean, but this questionnaire, this is built on stigma and ignorance. This is classic government building questions when they truly don't understand what they're talking about. Or maybe they do when they need us to remind them that, come on, you guys, wake up. This is an isolate, it's a medicine, give it a DIN, move on.
Yeah, well, we just have to keep shouting that. Karen Colville, you just made a comment in the chat. I don't see my screen though. Would you like to speak to that? I don't see her on the screen. Perhaps.
Yes.
Oh, there she-
One point I want to make is if that's separated in a sense, it has to be properly designated for what areas the plants and the molecules and whether they're isolates. I have a problem with the isolates being part of the medical system as much for people that are choosing to have cannabis treatment in hospitals. It's not here yet, only in Sunnybrook Hospital for cancer treatment, to my knowledge. There is the issue of private and public health. So how is that going to be designated in the future is something. It's a good thing that we're talking about this now.
Mhm. Yeah, absolutely. I think that, well, I think that one of the biggest issues that we've already touched on is just the level of ignorance, the lack of education that is going on within our healthcare system, within, at the government level. We need to, it's really lovely to have such a full room here with all of this input, because I have yet to hear anyone who seems to be on a different page. We all seem to have the same feelings about this, so that's a great thing.
Next.
Lori, I think, yeah, we can move on to the last slide, or the last questions. So based on the Scientific Advisory Committee's health products containing cannabis recommendations and objectives of the Cannabis Act, the place of sale is proposed to be veterinary clinics. Currently, only prescription veterinary drugs are required to be sold pursuant to a prescription by a veterinary through their clinic. Any non-prescription products can be sold in other retail locations, such as pet stores and front of counter at veterinary clinics. Do you agree, or do you have other considerations or concerns for the sale of veterinary products that contain cannabis in a pet store or a general retail store? I personally think they should just be allowed to be sold anywhere, just like I believe that we should all be allowed to grow as many plants as we want and consume our medicine in the way that we see fit. Would anybody else like to chime in? No,
Yes, it should be available on the shelf if your animal needs it. Just like you would go buy them any other supplement, like an omega-3 or recovery or anything else that contains, something that is beneficial for the animal.
I want to intervene a little. Also, it's important to be able to have these products as prevention. It prevents a lot of diseases, as well as helps alleviate some of the problems with certain diseases. So the thing is that it's such a broad spectrum that the regulations, it's not just the government, but it gets very complex as we look at it all. So yes,
Nice.
it would be great to have access, full access everywhere, but there
These on
still
sale
needs
too?
to be safety
I saw that.
and efficiency and all that. So yeah.
Yeah, I completely agree with you, Karen. Unfortunately, I think it's a hard sell, right? Especially within our current medical system and how things are treated. We don't deal with prevention, we deal with putting Band-Aids on after the fact, because it's a great way to keep our healthcare, or what I like to refer to as our sick care system going, right? To keep us unwell, give us some Band-Aids, and then we keep coming back for more. Nadine, did you have something
Yeah,
you
I
want?
was just going to add that, our medical system is one of reactive, not preventative. And so, until the medical system changes their ways, that it would be better to, 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 what's the word I'm looking for? To utilize preventative care to prevent, like you say, all these diseases and cancers and things like that. But no, it's what, like you're saying, it's a sick system, right? So that's all I was just going to add.
I love that. I remember the whole prevention is the best medicine that
Yeah.
used to be like commercial in the
Yep.
80s and 90s. And now medicine is the best medicine to
Yeah.
them. And
Yeah.
they have no talks about prevention whatsoever. And I think that's a great conversation that many of us need to be having because, disease is running rampant.
Yeah.
Absolutely. So the last question is in regards to veterinary products. Again, what unique context or challenges should be considered? Being that none of us are actually vets around the table here, I'm not sure how
I
clearly
have
we.
some experience with that.
Oh, thank you,
Kendra?
Kendra.
Yeah, absolutely. So basically the thing that I know about animals is dogs especially have more endocannabinoid receptors than we do. So they require just a very, very low dose, especially low dose with THC. So that's where I think hemp products are great. We usually talk about how hemp is largely unregulated in that sort of NHP market. So I think bringing official CBD to the market is going to be a really beneficial thing for pets and vets. So I think just really making sure that we can put some kind of standardized warning label on those is kind of what I think I'm hearing across the board with everything. If a certain product has a certain warning, then being able to standardize that for human and or animal consumption would be really important.
I think also just listening to you say that, it automatically peaks. Why are we calling it a warning? Why don't we just call it education?
Yeah.
Yeah, exactly.
Point in there. I feel the same way that, really the biggest, whatever challenges that are out there is the lack of education and our lack of ability to educate, right? Whether you're walking into a recreational outlet, or you are talking to your doctor or your pharmacist, or you're talking to the owner of the natural food store that you're going to, there is a serious lack of education. And education is the first step that we should be taking to reduce harms or potential harms, not warning labels. Cannabis is, what station was that on? CBC, Joy, that you mentioned? Of course.
CKNW.
Oh,
Global.
okay. Global. Okay.
Crazy.
Yeah, it is. So that, and again, that just shows the level of ignorance out there, which is why we are here.
Well, I see it as a deliberate movement to from Health Canada to push everybody away from it. They're so controlled by the pharmaceutical industry. I mean, I'm a patient, as you know, for 25 years now. When I got my license, my doctor signed it. It took them 6 months in Ottawa to tell me I could grow it. I had friends that were dying of cancer. They would have been dead in 6 months. We've never, ever been given dignity. I don't know. That's why I'm pushing for provincial, because the federal government, they're not doing anything in a positive way. But provincially, it is their responsibility under the Canada Health Act to deliver all medical programs. And I just believe we need to stay pushing it, because even though it's recreationally, the provinces are doing their own thing, and every single one is so different and really horrendous here in British Columbia for the dispensaries that are trying to stay medical. And they have this community safety unit going around shutting everybody down and fining them for multiple millions of dollars. There's just nothing positive to come out of that either. So what can I say? We're all trying to get our dignity and got to throw a lot of mud on the wall for something positive to stick. And it's a long, long, long journey. I know all of you been at this as long as I have, or probably longer. It's only been 22 years for me, but
Well, thank you, Joy, for all the work that you do. And you're absolutely right. We just need to keep advocating for ourselves and everyone else. Shall we move on to the next slide, Jay?
Yeah, I think that might be.
That's the end for the discussions. Did you drop the links in the chats so that everyone
I
could?
have dropped a couple of links, but I will do that again. I just have so many things in front of me. But yeah, as we said, we'll be taking all your input today, and we will be putting it together into this white paper. And hope that Health Canada is listening. That's all we can do really at the end of the day. We're here to advocate for the plant. And so we have to say something rather than nothing. And this has been a great discussion today, and it's definitely given us a lot to think about. So we are going to be working together with some other members, some people who are here on this call today in formulating this white paper. So if anybody on the call here is interested in joining us, helping us out with this project, you are more than welcome to help us out. And you can just email us at educannationinc@gmail.com and let us know that you're interested.
Yeah, and what that will look like is we have a working doc that we will share that you can have access to include your comments, include your opinions and help us formulate our responses. We do encourage everyone that is attended today, share the fact that this response exists out there in your communities. Make sure that you respond as individuals. Take what we discussed here today and what rings true to you and do your own individual responses. How can they ignore us if we're all saying the same thing? Let's build our voice together. Please do jump in, Dave.
Yeah, I just wanted to say maybe on a positive note, I've been doing this for a while, since 94, right? So it's been over 30 years, and I've seen a lot of regulatory changes take place, and it's easy to get discouraged, and I often am. It's a difficult business to be in, that's for sure. But I have seen that this kind of a white paper approach has had, in my direct experience, had a material effect positively on the way that the regulations have come forward. So I know it's easy to get discouraged, and they don't listen to everything, that's for sure. But, right from the early days of hemp being legalized through to the new cannabis regulations and CBD, hemp-based CBD being part of those regulations, outdoor growing being part of those regulations. There were some big corporate entities who have pushed back against a lot of this over the years, and a bunch of people who really care and who are willing to put in the effort to put forward a well thought out reason why things should be different have, in my experience, it's actually worked. So for what it's worth, I'm positive.
Yeah, I appreciate that perspective because it really is easy for us to get down and to be frustrated and to feel like all our efforts are for nothing. But I appreciate you sharing that with us. So everybody answer individually, and then if you are coming to us from a partner organization, make sure your organization responds as well. We are going to do the same, and then we will appreciate your signatures added to our white paper. We will make sure to release it before June 5th, which is the deadline, so that you can share it with your communities and we can build our voice.
Thank you.
Yes, thank you. Thank you for what a great session today. We were a little nervous when we started because we thought, I hope people will want to participate, and what a great group. Thank you so much, everyone, for your input.
Donna?
Yes.
So, would it be helpful to have a hemp farmer from the recreational market involved in this conversation? I have a friend is Seven Tails. She's in Saanich on Vancouver Island, and she does a pure CBD. Or there's Christine of Grown Here Farms, also does a pure CBD. I just wonder if bringing them into that paper may be beneficial for you guys. I can connect just through the info@educanation.com.
Absolutely. The more, the merrier.
Yeah, absolutely.
We do have one licensed producer working with hemp with us here today, and of course,
Awesome.
Mary Ann grows for him as well, one of our members. So yeah, the more voices we
Yeah.
have, especially industry players that have
Yeah.
experience, please do get the word out there.
Okay.
Send our email around. We will do our best to include everyone, and we may also I think it would be appropriate, we'll schedule sort of like a wrap-up meeting before we submit, so that anybody who would like to add their names or have their input will be able to have a little recap together before we send things off. So yes, thank you. Thank you so much for being here today. And yeah, just keep screaming.
Keep it on.
Keep it on. Yes. Thank you all so much for being here today. Appreciate you taking the time.
Thanks
We
for having
appreciate
us.
you.
I'm gonna stop.
Appreciate you. Ciao.